The Bite Check.
Hi, welcome to the Bite Check, where
Hip
is the guideline and
the
drama is
real.
And the drama is always real.
One of these days we'll get the intro right.
Right. We are your hosts. At least we know our names. I'm Lynn.
And I'm Malia.
And we want to thank you for tuning in. And we want you to check out
Our new shirts.
Check it out. Check it out. Thank you to, oh my goodness, I meant to have her card. But In His Image is who made the shirts for us. So thank you, In His Image. Appreciate you.
Thank you.
Yes. And let's see. So today, we want to thank everybody who has been watching. And we want to continue to ask you to like, share, and subscribe. Subscribe. And get your friends and family to come and check us out too. And when you go to your dental appointments, let them know about the Bite Check, because I'm pretty sure they'll enjoy the funny stories that we share. But so anyway, today we're going to be talking about swallowing things at the dental office that you shouldn't be swallowing. The only thing you really should be swallowing at the dental office is your own saliva.
And it's okay to swallow your own saliva too.
Right.
You don't have to go like this.
Because I do get it though, because like, you know how when you're numb, a lot of times once people are numb, they feel like they can't swallow anything.
I got numb just a few months ago. I could swallow just fine.
No, but I'm just saying, I know you can, but I can see why somebody might think that they shouldn't.
No, they're like, oh, is it okay to swallow? I said, yeah, it's your own saliva. Why? I wouldn't let you swallow nothing bad.
Yeah.
You were the ones that swallow bad stuff.
Right. But yeah, it's okay once you get numb. Speaking of also getting numb too, like the things that you want to be careful for is like, people tend to want to gnaw because, so that's the things, but it's okay to swallow, but it happens a lot that people think that they can't swallow. So that's why, we feel like it's worth talking about. But of course, there are things that you shouldn't swallow.
There are some times that people should have asked me for a suction and then swallowed.
Okay, I gotta tell you a story though that happened a long time ago. So it was an older person, and they were their crown, I guess, was loose.
Yeah.
But I guess I wasn't aware that the crown was loose. I knew that we were going to be taken. So they were in to have the crown replaced. But I don't know why I didn't have the details that the crown was actually possibly loose. So I took the impression for the temporary crown, and then and I had the patient sitting up, and so then I took it out, and she started going and I was like, oh, it's okay, she says, there's something in the back of my throat. So no, it's not funny because I felt bad. It's not funny, Malia. Stop laughing.
Sorry.
So I said, I looked at the impression, and you know how you can tell like if it ripped or something.
Yeah.
So I was like, oh, no, it's pretty intact. So I don't think anything is in her mouth. And so anyway, she was like, something's in my throat. So I said, well, do you want me to rinse you out? And then she says, well, I just want some water. So I gave her some water. Well, she drank the water. So then when we got ready to do the procedure, there was a crown on that tooth that wasn't there anymore. So I know I felt bad because she said, wait, there's something in my throat. I'm like, basically, I honestly was thinking, no, there's not.
Yeah.
But obviously it was the crown. So anyway, she should not have swallowed. I feel bad that she swallowed her crown. I mean, that's okay too, because this too shall pass.
Yeah, you can't do anything about it.
They'll pass it.
I also had a patient swallow a crown once, and it was, it was like a premolar, I think, and we were trying it in, and when we had to like shimmy it out, and then it slipped, and then it was like in her throat, and so I was like, spit it out, and she was like, gulp.
Wait a minute. You told her to spit it out, and she's just, and then
Yeah,
now they want to swallow. You know.
Yeah, and I'm like, sit up, spit it out, and I heard the gulp, and I looked at the doctor, and he goes, "Do you want me to gag you?"
Oh no.
She's like,
oh my God.
What was that? And we're like, well, that was your crown. And she goes, oh no, and like freaking out. And she's like, our doctor was like, cough it out. So she's
like, it's gone.
Trying to cough. And then she's like, I can't get it out. And she goes, you want me to gag you? She's like, no, maybe I can have something to eat. So normally in our office, we have a lot
something
of...
to eat. Was it to get it back?
Well, because she like felt like it was stuck in her
okay, I
throat.
see. Yeah.
And so, I mean, at that point, we couldn't gag her, and she wasn't coughing it up, so like it has to go down. You know?
Yeah.
And usually at our office, we have a bunch of snacks. Well, that week we didn't have anything from Costco or any food, which is very rare.
Yeah.
So we had like cheese. We had like cheese squares, and I think he went and got her a bowl of cheese squares.
I think I do remember that.
And she's like eating the cheese squares, and she goes, well, what's gonna happen now? And like, oh, we'll make you a new one. So after all of that, right, I make her temporary, put it back on. She proceeds to tell me this isn't the first time she swallowed a crown. She swallowed a crown a long time ago and brought it in, let it pass, and then brought it in. She said they put it back on. This is a long time ago. I don't even know who saw her.
Wait a minute, but remember with the previous owner, that actually happened where it was a guy though, so I know it wasn't the same person. Remember, no, I thought you were the one working with the previous owner when the patient. I saw the patient. The patient came in because he had swallowed. He swallowed his crown at home. He, in his words, he retrieved it and he cleaned it, and he was bringing it in for us to resubmit. So the doctor was actually with the patient, so I wrote her a note, and I wrote the note that said, patient swallowed crown, retrieved it, cleaned it, and now wants to resubmit it. How do you want me to proceed?
What did she say? I can't remember.
Because you know how we put the note down for them to read? So she was like kind of working, and then she looked at the note, and then she went...
I do remember this.
And then she stopped. She says, oh, wow, okay. Never had that happen before. She said, well, put it in the sterilizer.
Yeah, that's actually good. Yeah.
So we sterilized it and ran it through the sterilization, and then when it came out of sterilization, we resubmitted it. I mean, he saved himself a lot of money because a new crown is like $1,500, where a resubmit is only, I think a resubmit is like
$75.
I think it's less than $100.
Yeah.
So, I mean, he saved himself a lot of money, and he got a good story to tell that he had the crown, he passed it, and brought it in, and he cleaned it at home. I don't know how he cleaned it. I didn't ask him. But then we actually put it through our normal sterilization, like it was one of our instruments. But yeah, so yeah, people.
Actually, I've also have a third story about this. It's not like a patient that I've had, but it was my boyfriend, somebody on his crew that he works with. They were talking about dentistry or whatever. I don't know how the subject came up. And he goes, "Yeah, I lost a crown once." And I waited for it, and I brought it to my dentist.
Wait for it.
I was like, I think I said the same thing when he told me this story. He saved himself a lot of money because, yeah.
Well, there are ways to prevent patients from, or to help minimize the risk of them swallowing things. You can put throat packs.
Yeah, now ever since that incident, I'm extremely paranoid about it. So before I even put a permanent crown in, like trying it in, I say, if this slips out of place, spit it out immediately.
Right. Oh, I do hear you saying that.
And the doctor's like, yeah, she's a little bit paranoid. Like, yeah, you know what? I am a little paranoid.
Yeah. So, we are working in people's mouths. They're laid back.
Especially on the top teeth. Gravity is not in your favor at that point.
So we recommend that if you feel something in your mouth, the first thing you shouldn't do is swallow. But then on the other hand,
there's a
if
difference
it's your
between
own saliva,
There's
it's okay for you to swallow your own saliva.
You know the difference if there's saliva in your mouth versus there's a chunk on my tongue. You know the difference. I mean, you eat food every day. You know the difference.
Yeah, that is true. But now it is kind of scary though, because I guess we're laughing about it because I've never had anybody aspirate, but it can be very dangerous if they aspirate it.
Yeah, but how do you aspirate? You have to breathe in when you do it, right?
Yeah, yeah. It's kind of like talking with your mouth full.
Yeah.
You know, so if they aspirate it, then that's a whole nother procedure where they have to go and have it surgically. Yeah, they have to have it surgically removed. But yeah. So at the end of the day, we as the dental professionals, we actually have the burden is truly on us to make sure that we do everything in our power to minimize the risk of them swallowing. And like you do, informing the patient saying, hey, if you feel something in the back of your throat, don't swallow.
Sit up and spit it out.
Sit up and spit it out, yes, yes.
What about that oral surgeon?
Oh, gosh. So we had this patient that came in, and I literally had to laugh. So she came in, and she was, like, upset at she had went not to anybody that we referred to, but she had came to our office as a news patient, and she had told us the story about the oral surgeon. She swallowed an implant driver, and an implant driver is
long.
They're about maybe the size. I don't know, maybe the size of your pinky, like the top part, the fold of your pinky, because it's hard to scale when you're looking at a video. But they're pretty big, and she swallowed it. But what was funny is she said after she swallowed it, the surgeon said, "Why did you do that?"
I would be pissed. Those things are expensive.
No, that's all the surgeon cared about was her swallowing her expensive surgical instrument.
I mean, that stuff's not cheap.
The patient was, I said, what? She said, yeah, she yelled at me. And she said, why did you do that? She said, why did I do what? Why did you swallow my instrument? She said, I didn't try to. It's not like I came here to swallow. So she was telling us.
But okay, so how would you not know you're swallowing? Because
it's big. It's huge. Yeah, I don't know how she did that.
Sharp too, so like that's not like swallowing something smooth.
Yeah,
like
yeah. The surgeon was. She said the surgeon was pissed. And I'm sorry. I just laughed. I told her, I said, I'm not laughing at you. I'm just laughing at the situation, because I said, wait a minute. What did she say? She was like, yeah, she yelled at me. She was like, why did you do that? And she said, I said, why did I do what? Why did you swallow my instrument?
Well, because now she's probably thinking, you swallowed my expensive driver. Yeah. I'm going to have to pay for your hospital. And I'm probably going to have to end my day because I can't do anything else.
Right. Yeah, because the surgeons are probably all her patients.
Yeah.
I'm pretty sure they had other ones, though. But still. I just thought that was
a hefty bill.
Yeah, I thought it was hilarious though how the patient was telling the story, and I was just like, "Wow, I can't believe the surgeon was just like, why did you do that?" But anyway, thank you for listening to our corny stories, and remember, as we always say, please like, share, and subscribe, and get your friends and family, encourage them to tune in.
And don't forget to comment.
Don't forget to comment. All right. Thank you so much for watching.
Bye guys.